Okay, hey guys. So our medical presentation is on a cesarean section, or also known as a C-section. And obviously we're talking about pregnancy, birth, and lactation. I'm Ryan.
Tanika.
Gracie. Elsie. Okay.
Okay, so my patient's medical history, her name is Taylor. She's 28 years old. She's a first-time mom at about 39 weeks, which is considered a full term. She's been healthy and active throughout her entire pregnancy, but just recently she's had some symptoms of shortness of breath and then feeling like a hard lump in her upper abdomen, which is most likely the baby's head. So weekly prenatal visits start at 36 weeks up until delivery, and then week 30 to 35, the baby should naturally turn head down and feet up. Around her 39-week ultrasound had confirmed the breech baby position, which is her baby's feet first. So delivery options are discussed. There is an option to manually move the baby on the outside, which gives a 58% success rate. For a C-section, the position of the baby and a narrow pelvis, and then a planned breech birth, but this is rare, and the provider has to be have expertise in breech deliveries. Higher risk for vaginal delivery is a cord prolapse, which is the umbilical cord coming out before the baby, which you can see there on that little picture. There. That deprives the baby of blood and oxygen and happens in 1 in every 300 births. Also, head entrapment, which is the baby's head gets lodged in the mother's pelvis. So our goal is to ensure the safety and the well-being of both mom and baby, to surgically close mom up, and then skin to skin for breastfeeding and mom's maternal recovery.
Okay, so what is a breeched baby? A breeched baby is when the feet or buttocks are positioned to come out first, and ideally you want the head to come out first. If the baby is breeched by 37 weeks, then most likely the doctor is going to bring up different options like a C-section, which is usually the safest option in this case. Only 3 to 4% of babies are breeched at birth, and then a vaginal delivery can be very complicated and dangerous, and most doctors are actually not confident in doing the procedure. The 4 types of breech baby are going to be the complete breech, when the knees and the hips are flexed, and then the flank breech, which is when the legs are straight up. The transverse lie is going to be when the baby's laying horizontally on the uterus, and then the footling breech, which is when the 1 or 2 feet are positioned to come out first.
Alright, so who's going to perform surgery? Usually your OBGYN or a trained surgeon will be performing alongside a medical team, including the anesthesiologist, labor and delivery nurses, and sometimes a pediatrician. This will generally take place in the labor and delivery operating room, but if you have an emergency C-section, that's going to take place wherever and where it's safest for mom and baby. And then basically for this procedure, you're looking at 2 incisions made, usually in the for an abdominal incision. It's going to be a low horizontal cut near the pubic hairline, and then a uterine incision as well, and that also might be changed due to baby's position. You have the delivery process looking like baby being delivered through the incisions, and then getting the fluids cleared from baby's lungs, if there are any, and getting baby to breathe. And then you have the umbilical cord being clamped and cut, as well as the placenta being delivered. The incisions are then closed with sutures, and then if you have just regional anesthesia, just light sedation, you're going to be able to hold baby immediately after, once they get baby cleaned up. Or if you are put under general anesthesia, obviously once you are woken up, you will hold baby.
Okay, so the recovery is obviously different for everyone, but most people experience vaginal discharge, contractions, sore breasts, hair loss, or skin changes, mood changes, postpartum depression, and weight loss. What you should do is get lots of rest and ask your doctor about pain relief drugs, as well as check for signs of infection like changing colors, swelling, and leaking fluid. You should also meet with a lactation consultant, which will talk to you about breastfeeding, which is optional. You should start skin to skin as soon as possible. The best ways to breastfeed a baby after is going to be the football hold or the side laying hold, which is like here. Some challenges are sore or cracking nipples, low milk supply, and you may need emotional support. Some other options if you don't want to breastfeed are going to be things like pumping and bottle feeding, or giving the baby formula, which is also bottle feeding.
What are the risk factors? So the risk factors to babies can be breathing problems, is transient tachypnea, which this is kind of like right after it's given birth. There's going to be like some fluid in the lungs. It's retained fluid in the lungs, which is usually gone within 24 to 72 hours after. It's usually shown up on x-rays, and the doctors put IVs or they feed the baby through a tube, nasopharynx feeding, sorry. And then some risk, then there's gonna be some rare surgical nicks. And then the risks to the mothers are kind of more bigger, and infection, more blood loss, anesthesia reaction, blood clots all over, and then rare bladder or bowel injury, and then higher future pregnancy risks like scar tissue, placenta tissue, and uterine rupture. Other reasons why you may have a C-section is the cervix stops dilating, which causes distress, and the reason that cervix stops to dilate is because it's either too weak or your pelvis is too small that it physically can't. And then placenta previa, this is where the placenta covers the cervix, so it kind of just implants it. The placenta is implanted right on the lower uterus. This can be caused by multiple reasons, but it's usually caused by uterine surgeries, previous pregnancies, or sometimes even smoking. It's also you have a C-section when you carry more than one baby, so if you're carrying like triplets or twins, because there's so many complications to vaginal births that it's kind of more easier for a C-section because they have it more under control, I guess. There's also a prolapse umbilical cord. This is actually when the the umbilical cord comes out right before the baby is presented, which can be really fatal because it causes pressure on the cord from the baby, and we'll have no blood flow and no oxygen flow, so it's really fatal. And then also, if you've had a C-section before, you'll most likely have a repeat. And if you know you're getting a C-section ahead of time, you can actually schedule one with the provider you have at 39 weeks, because that's the best time that you're like fully done with your pregnancy.
These are our resources.
Questions?
Any questions?
I have a question.
Yes, Heather. What can I
So, what kind of anesthesia does a woman undergoing cesarean section receive? Do we get anything? No?
Epidural.
Epidural.
So yeah, epidural. But then if you're getting a C-section, I know you can get like laughing gas as well.
A little
And
nitrogen
a little something to
Little something, something, help you.
relax.
But the epidural is an important piece, because without the epidural,
It's
right,
like
and the reason you wanna keep the mother awake is so you can have that skin-to-skin contact immediately upon bringing that baby out of the uterus and laying it on her chest. Very important. I was transverse.
Ooh, she's transferring.
I was transverse, and they did try and manipulate me 3 days prior.
Oh, it's in so much pain.
Oh my God, can you imagine?
Your poor mother.
My poor mother.
Gosh, Heather.
I know,
Come on.
but I did come out brown-eyed blonde, you know.
Can't win them all. Can't win them all.
So they